Welcome to Amazing Interviews. My special guest today is Professor Claudio Borghi. Claudio is a worldwide recognized expert in hypertension, but not only in this, because he is the head of the Department of Cardiovascular Medicine in famous University of Bologna, who was built in 1088.
88, yeah.
So, first in the world. How looks my country at the time? So I put the question. So congratulations, because it's telling a lot about the way of doing things right in Bologna. Welcome here, Claudio.
Thank you very much. Thank you for the invitation. I'm really happy and proud to be here in this wonderful country and with a great friend like you.
Thank you so much. So we have a discussion about cardiology and about the successful career in cardiology. So are there specific ingredients for becoming a successful person in cardiology? Please tell me.
Basically, I think that everybody has its own ingredients. But after more than 40 years of active activity, profession, I would say that probably the most important ingredient is passion. You have to have passion for everything, and you have to have passion for medicine. And this passion, I think, should be translated in your interest. Whether you want to be an hemodynamist or a clinical, you have to make everything with a great passion. You have to be prepared. But after that, you have to try to understand immediately which one is your way and try to apply to increase your knowledge and you increase your activity in that area. So actually, if I'm looking back to my career, I think that everything I've done because of passion. So that's it, the word I would like to say to the young Romanian cardiology. Be passionate.
I'm expected to have this answer from you because being Latin, Italian, and living in the North, and you are full of energy, you are full, you are very hard worker. So if we are speaking about a perfect working day, how you balance the rest and working part, and what are your meals and how you're doing the day, because this could explain your energy.
Yeah, I think that I'm waking up early in the morning, not very early, but about 6:30.
It's early.
I'm not a very strong sleeper. I'm used to, let's say, to fall asleep around 1 o'clock in the morning, and I'm waking
so
up
5
at
hours and a half,
yeah,
6
yeah.
hour maximum.
That's enough, because during the night I like very much to read the paper, try to manage the paper, try to, let's say, make my presentation. Most of my presentation have been done during the night. If I would like to divide the time I spend in preparing presentation, maybe 75% have been done after 8 o'clock in the evening. Because before 8 o'clock in the evening, you know very well, we are all very busy in the hospital. I'm chairing this clinical department of cardiovascular medicine, which is pretty big. It's cardiovascular and cerebrovascular medicine. I have about 100 beds.
Wow.
And that I'm also the chief of the whole department of cardiothoracic medicine. That includes many other colleagues. So I have to give some time to my coworkers early in the morning while we take an Italian coffee or even 2 Italian coffee. We discuss about what to do during the day. And after that, I'm going to see some patient, the patient of interest, and then I'm taking care of all the procedural problems for the department and for my clinic. Then sometime I have my lessons. I have a lot of students, and I like the students. In the afternoon, I'm doing some private practice a couple of days during the week. And the only thing I don't do, and I would like to do it since I was a professional sportsman, is exercise. The only exercise I'm doing is walking. I'm working very much, more than expected according to the guidelines. And from this point of view, I think Bologna is a very easy city because we have the porticos. So you can walk everywhere,
exactly. I
downtown,
saw your city.
even when it's raining. That is my usual day.
So breakfast in the morning, only a coffee or something?
No,
something
actually, no, some yogurt and fruit. Yeah, and coffee.
Lunchtime?
The lunchtime, sometime I go out for the lunchtime with friends. We go to the restaurant, but I have just one course. In many cases, I have just a sandwich because my secretary is pretty good. She's coming from a nice place in the countryside. I have a good bread. She's bringing me some sandwich, and I have usually more food for dinner, which is not actually very good from the, let's say, healthy point of view. But when it's 7 o'clock, 8 o'clock in the evening, I'm terribly hungry.
Yeah, I can understand. Thank you so much for sharing this. Please give a message for young cardiologists from Romania, because they need this type of input from a person, a personality like you.
Yeah, I think the message is they should be prepared. The problem is, I think, in the last 20 years was that everybody in the area of cardiology would like to specialize in a specific branch. And so some of my fellow, I used to say, I'm a dynamist, interested in, I'm a doctor for heart failure, I'm a doctor for arrhythmias. But you know much better than me that now the real important word in medicine is complexity. Most of our patients are pretty much complex. They have the cardiovascular disease, but they have some additional disease. And you cannot face this problem just considering the heart or the chest. There is something beyond. So I think nowadays, like it was probably in the past, in less sophisticated way, a good cardiologist is a good doctor.
A comprehensive view
of care of the heart, of the vessels, but is taking care of everything, because you know very well that many of the cardiovascular diseases are actually originated, or they are, let's say, increased by concomitant diseases, and we have to take care. So I would like to have more cardiologists which are also good doctors.
Yeah, because I met you being part of hypertension meetings.
Sure.
But for sure, have an open-minded view, and I admire also your way of trying to solve problems also between guideline.
When I'm talking about this, I'm usually to remember that I think the one of the top cardiologists in the history of cardiology, you know, is Jim Brownwald.
Yes.
Actually, Jim Brownwald was professor of medicine.
Yes.
Which means that you can be the best cardiology in the world, but if you know medicine. And that is the message I would like to give to you.
You have to have the background,
Sure.
the overview of all these things. And you, at that moment, you can go in one direction, but not being stuck from the beginning.
No, because I saw some years ago that many younger people were used to go in just one direction. Yeah. They ignore completely all the other aspects of medicine. And that is a big mistake.
Very good message, and thank you so much. At the end of our short talk, please allow me to put a couple of questions from the James Lipton questionnaire. He used to put this question to Hollywood celebrities, and we as cardiologists, and especially as famous cardiologists like you, I think you deserve this type of question. So first of all, what is turn you creatively, spiritually, or emotionally? Are there things or facts or?
Animals. I like very much animals. Maybe in my previous life, I was an animal. And when I see animals, in particular dogs and cats, I try to look into their eyes, and sometimes I get a lot of inspiration. I have a couple of dogs at home, but it's the same for every animals I met in my life. I got some inspiration from their eyes, and I think that the best moment of my life, I've always been associated with some, let's say, exchange with an animal.
This is a part of way of doing things, and you are so emotionally connected to all these things. So empathy is also connected with this. Wonderful. So what profession, other than your own, would you like to attempt?
It's very easy to say veterinarian.
Yes, it's linked with the first.
Every profession that could give me the opportunity to be in contact with life. So animals, plants. My first idea was to work in agriculture and to take a degree related to agriculture, and then decided to move to medicine because the man, of course, is most important. But I think I couldn't make any other profession apart from being in contact with life.
Perfect. In opposite, are there professions would you not like to do?
I would not to do any profession that couldn't give me some emotion. I hate to know what's going on. So I couldn't be a clerk, for example, or something like that, a profession that you are doing all the same thing
Yes.
every day.
Yes.
I definitely
Repetitivity
prefer
and
a profession where there is some level of unexpected. And of course, the medicine and doctors is the most
it's an
unexpected.
amazing profession. It's
You're
exactly.
getting out in the morning, you don't know what's going on.
And the last, we are believers because we are doctors. So, what would you like to hear God say when you arrive at the pearly gates?
I think I would be very happy if he could said, would you recognize me? Which means that I have met him many times in my life, and I'm pretty sure that we are meeting God many times in our life as a doctor or as a person. And I would be very happy if I would like to come toward me someone that I know, and he said, would you recognize me? I was that guy that was on that day in the bed or somewhere, and you give me one hand or something like that.
Caro Claudio, dear Professor Borghi, it's a pleasure to discuss with you and it's a pleasure to meet you. You are welcome here every time you want, and we are looking forward to meet again and to share all these ideas. Thank you so much for coming here.
Thank you, Dan. I consider Romania my second house. So.
Grazie di cuore.
A voi.